No vaccine has been approved yet, but we do expect to know if Pfizer is approved this week and Moderna next week. We will begin distributing initial doses of COVID-19 vaccine to those at highest risk of COVID, healthcare workers and residents of long-term care facilities. This is based on recommendations by the CDC, ADHS, and our local partners representing various health-focused fields. By protecting healthcare workers from providers to long-term care staff to cleaning crews, we are protecting those who have the highest exposure and whose health will help preserve our healthcare system. We know that our hospitals are under immense strain right now. Protecting healthcare staff keeps hospital beds staffed so they can continue to provide care. As more doses become available, more people will be able to get the vaccine. As long as there is limited supply, we will work towards equitable allocation that supports people who are at highest risk. We anticipate that it will be available for the general public by spring, but that may change depending on how the vaccines are approved and how quickly doses are manufactured. These vaccines will be distributed at 5 regional sites we are setting up with our partners in the initial phase. The most effective way to distribute a limited supply of vaccine to these specific groups is by us setting up these 5 sites. This is a Herculean effort, and public health has been working towards this for months. We have taken all the planning we in public health do for emergency response, and we've adapted it to this specific situation. We would not be able to do this and implement this important and immense plan to administer thousands of doses of vaccine in a few short weeks without our amazing partners. I'd like to recognize them now. Abrazo Health, Banner Health, Dignity Healthcare, Honor Health, the National Guard, local emergency managers and planners, EMS, medical volunteers, and so many more. We know that many people have questions about the safety of this vaccine. We will be working with external, non-governmental review board who is looking at the data. This group is made up of scientists, medical ethicists, medical experts, pharmacists, and others, and is separate from the review that the FDA is conducting. We want to do our due diligence to be sure that the vaccine is safe and effective for our community.